issue across the country, and the American people are telling us that the individual the mandates, the requirements to buy insurance are something that they want us to scrap and start over on. And that's why you're seeing state legislatures around the country passing resolutions saying our citizens are going to have a choice.
So that was essentially the Republican position. That was Republican Congressman Dave Camp out of Michigan at yesterday's health care summit. He had his turn at the mic, and we wanted to bring him back today and tell us how he thought it all went yesterday. Dave Camp out of Michigan, ranking member of the Ways and Means Committee, my guest from the Hill. Sir, good morning to you.
Hi, Bill.
We watched the whole thing, all 7.5 hours of it. And I think it all boils down today to two. No, it's okay. It's our job. It's your job, too. 2 words, sir. What now?
Well, I think we need to hear back from the American people. What we've been hearing is they don't like the bill that they'd seen. They wanted us to try something new. We had an opportunity to get ideas out, and we think we ought to bring costs down in health care while still giving people the kind of choice and flexibility that they need and they want to get the kind of health insurance that they deserve. And we also think that we should address the issue of pre-existing condition. There was probably the most common ground on that. However, we want to look at it in the context of an approach to health care reform that does not start and end in Washington, D.C.
Well, if you pick up any newspaper today, they seem to pick up on the same 2 angles in every paper. The summit shows the differences in opinion, and the summit shows how wide apart the 2 sides are. Take it from another angle. What does it mean to Democrats if they do not get health care through?
Well, this has been their signature issue. They've invested a lot of capital and a lot of time on it. I think Americans want health reform. I just think it's what kind of health reform do they want and should they have? And that was what the debate was about. It gave us an opportunity to highlight those issues. I think the American people win on that because they were able to see in a public forum what our ideas were. In the past, we'd had these bills written behind closed doors. We had 3 days to look at them, and it was a yes or no, take it or leave it approach. I think it was more important to see what sort of underlies these issues and now for us to hear back from them. But I think they want us to control cost and do it in a way that doesn't mean that the federal government determines, designs, creates, and implements a health insurance plan for every American in the country.
You said twice now you want to hear from the American people. President Obama in his closing remarks yesterday said he needs to hear from Republicans. Roll this and I'll ask you about it.
I'd like the Republicans to do a little soul searching and find out, are there some things that you'd be willing to embrace that get to this core problem of 30 million people without health insurance and dealing seriously with the pre-existing condition issue. I don't know, frankly, whether we can close that gap.
Is he right?
Well, that 30 million people, of course, half of that is an expansion of Medicaid, which we know isn't inadequate coverage for anyone, and I think that would not be an appropriate direction to go in. But I think that if it's, are we going to spend $1 trillion? Are we going to raise taxes by $500 billion? I think the answer is no. Are we going to have an approach like theirs? I don't think that's the direction we can go in.
So you're saying that the gap cannot be closed then. Do I hear that correctly?
Well, I think on the approach to health care, the gap cannot be closed. I don't think that having the Secretary of Health and Human Services take the control of health insurance from the 50 states and define and create and define what health insurance is for every American will bring down costs. I think that will mean a more expensive plan. As the Congressional Budget Office has evaluated, premiums will go up under the mandates that will come forward in a federal government created health care plan.
Okay.
That is not going to help the American people.
It was fascinating to watch. Now, just a question on style here for a moment. What was the Republican strategy going in? It appeared that every time Mitch McConnell or John Boehner had a chance to defer to one of their, I will call them specialists in this matter, that they refer to you or Tom Coburn or someone else in the room. And Karl Rove had an interesting bit in his Wall Street Journal piece yesterday that Republicans actually drilled on this. You practiced almost in debate form. Is that how you got ready for yesterday?
Well, to get that many people together and practice what happened. We did together and discuss what issues we were going to cover and what we might say. But a debate practice is probably more credit than we deserve.
Okay, Dave Camp coming on today. in a matter of minutes. Dave Camp from Michigan. Thank you, Martha.
All right, it is Snowmageddon, the